I'm Leslie Elliott Boyce, and this is The Radical Center, a recording project I began in 2022 as a way to describe and discuss the social and ideological currents that are rapidly altering our culture. In a time when political polarization seems to be the norm, I'm seeking to understand rather than react. I'm grateful to all the thoughtful men and women who share their stories and insights with me in this conversation series. If you would like to contribute to this project financially, there are links in the description. Thank you, and thank you all for listening and being part of this exploration. Today I'm speaking with Rebecca Smith, and Rebecca, you are a therapist specializing in high conflict divorce, and I'm really curious to hear more about what you've been working on. You've been working on some legislative bills, and you have some research into correlation between transgender ideology or transgender identification and high conflict divorce. So this kind of trauma that's happening, and I'm kind of coming in fresh, so I want to hear all about your research and what you've been working on. And perhaps could you start by just saying a little bit about yourself and what got you into the work that you're doing right now?
Sure. Well, thanks for having me on. I'm really excited to share a little bit about what we've been doing here. So I'm based in Texas, and I have a private practice, a pretty large private practice with about 25 to 30 counselors, and they start as interns. And so I've got a pretty hefty internship program that I lead. So what happened is about probably 16 to 18 years ago, I started my practice, and I was working with foster children. And in doing so, our courts here in our county were not specialized at that time. And so I was working with the CPS cases, and those lawyers were also working with family law cases. So they started bringing me into some of the family law cases. And that's how it really got started. But I could never leave my CPS work because those kids, I just love them so much. And we think that we're making a difference for them, but they're really making a huge difference for us. So it was such a blessing to be able to work with them. So that's when I decided I had to figure out how am I going to navigate this, and I grew my practice, and that's why I have the large internship program. So in doing this, I was observing this really interesting phenomenon with alienating behaviors. And when I have my children that are in the foster care system, and we have proof that abuse has occurred, yet they're still wanting to go home to their biological family. But then I have these high conflict cases where there's no history of abuse until the date of divorce. And that's when the abuse allegations begin. And so that curiosity of what is this phenomenon? How is this happening? Led me down this very huge path of research and trying to understand. And then fast forward to where we are present day, probably about I don't know, 6 or 7 years ago, I started hearing this dialogue that I had never heard before. And the dialogue was about the transgender culture ideology, however you want to specify that. And when I first started hearing this, because I graduated with my master's 20 years ago, I worked on my PhD, but I dropped out in 2006. I didn't finish the dissertation part. And so when I hear the interns talking about this new dialogue, I was very curious. And so I started buying the textbooks and trying to understand what they were discussing. And in doing so, I'm reading about this gender affirming care. And I couldn't believe what I was reading because, first of all, a counselor isn't supposed to advocate for their children within the family unit. We want to respect the parental rights first. And so these alienating behaviors are happening, and they just kept growing, not just within the mental health profession, but now I'm seeing it in the educational world, and it's just expanding from there.
Would you
And
define
so,
alienating behaviors? What do you mean when you say
sure.
alienating behaviors?
So alienating behaviors are any behavior that's going to frame the family in a negative way. It's going to kind of be some emotional manipulation. It's essentially like a campaign that's going to be launched for the children to side with, in divorce, it's to side with one parent over the other. And the culture as it is today, it's going to be to get the children away from their family of origin.
Okay.
There's secrecy, there's isolation, there's that exclusionary language of we and us versus them kind of thing. Um, and then there's this reinforcement of victimhood. So these are some of the behaviors that you're going to see. And what happens is the alienating piece, the behaviors are driving that wedge between the children and their biological family. And they're starting to struggle in trusting the children, and trusting their own thoughts and feelings and how they're able to perceive their reality. And so we can talk a little bit more about that. But did I define that
That's really
well
helpful.
enough? Okay. Okay.
And so I'm sorry, I interrupted your flow to ask you about
No,
the
you're
alienating
fine.
behaviors, but you said you started to see a lot of these alienating behaviors with regard to gender identity.
Yes.
Okay. And that was about 6 or 7 years ago, you were saying.
So, well, I started hearing the language
Mhm.
about this gender ideology 6 or 7 years ago, and that's when I started researching it. And the earliest I can trace back in the textbooks that I purchased and reviewed is 2015. So, in 2015 is when I started seeing the changes in textbooks for this transgender nonconforming is what it's labeled in the textbooks.
You mean
And also,
psychology textbooks or counseling textbooks?
yes,
Okay.
anything mental health related,
Okay.
yes. Sorry. And so from about 2015, that's when the rhetoric starts to change academically.
Hmm.
And it's not necessarily change. I think it's adding new information, new language with this gender affirming care. And in doing that, it was teaching the counselors to become more like advocates and teaching the parents how to accept whatever the children are professing to be. And instead of trying to understand the family values and where they are just coaching the parents to accept this new, affirm this new identity, whatever it is.
Hmm.
And so there's a wedge that's being naturally created within the family unit by encouraging, and that's that victimhood that they're encouraging. This victimhood, you're identifying as whatever you're professing to be. Your parents aren't accepting you, so let's work with the parents and see if we can get them to accept that. And it exacerbates this confused identity. Versus if we were all on the same page and aligned with the parents or the family values as a whole, then the children wouldn't attempt to seek out other opportunities for confirming or affirming whatever it is they believe they are in that moment in time. So we need for everybody to be on that same page with the parents so that the children can't seek quote unquote refuge because they're going through natural things. I mean, identity confusion is so natural at many stages of life, not just in our teenage years, but at many stages. And so if I am getting this attention and this positive feedback that makes me feel better or makes me feel good or makes me feel like I'm becoming an individual, individuating from my biological family, then I might be drawn to it because there's just natural discord that's going to happen as a teenager. As you well know, we call it the terrible twos, but it's really the turbulent teens that we're trying to gear up for, right?
Yeah.
So anyway, that's one of the issues when they're going to a professional or working at the schools and they start to socially transition and the adults in that arena are affirming, then it's playing into that victimhood. It's giving children this wedge with their biological family when they need to know that whatever your identity is here, we're going to have consistency across the board, just like with punishment or with our items going back and forth in a divorced home, transitioning from home to home. So the things that I have at one home, if I don't have similar things to that at the other home, then I'm going to reject that home.
Hmm. Hmm.
Right. So I want for my things to be consistent. And it's the same with the values and belief system. We want for things to be consistent for the kids because
Hmm.
consistency breeds predictability. Predictability breeds comfort.
Hmm.
So be consistent, give them predictability, and then comfort will follow.
Hmm. And how do you see this showing up specifically in high conflict divorce situations? Is it because that is an access point for therapy? Is that because that's when the therapist gets involved and so there's an introduction of this? Or do you see it as something else, something that's more maybe culturally organic? Like this is just an inflection point where people tend to collude against another party in the family, or how do you conceptualize that?
So I can see the transgender culture really impacting the high conflict divorce cases
Mhm.
and the foster care. And those are the two areas that I really, my practice is focused with. So when I've got a child that's going through trauma, well, we all
Mhm.
know that trauma leaves us extremely confused in and of
Mhm.
itself. We're going to have
Mhm.
some identity issues there. I've got the inability to solve my problem, or I feel stuck, and I don't know how to relieve this stress and this pain. And so in foster care, like we work with the kids that are in the orphanages, so they're kind of, for lack of better words, imprisoned. They don't
Mhm.
have an option on where they go, where they stay. They can't just have a normal life of going to a friend's house and playing, or walking outside and taking a 2 mile walk after school, because they're really kind of locked in those orphanages.
Mhm.
And it's the same thing for the high conflict divorce and custody modifications. They're really contained in those spaces, and they
Mhm.
don't have the opportunities to get out and have that quote unquote normal life,
Mhm.
whatever normal is. So they've got this trauma, and then we're packing on isolation.
Mhm.
We're packing on top of that the inability to solve our problems and relieve the stress and the pain. And so they're looking for any out. Well, I hear oftentimes I've got suicidal ideation. Well, when I talk to the kids about the suicidal ideation, 9 times out of 10, they're not truly suicidal. They don't want finality. In fact, they really can't even conceptualize finality, because that's such a grown up concept.
Mhm.
So teenagers, little kids, they cannot conceptualize. It's like trying to get them to conceptualize infinity. We can't
Mhm.
imagine endless.
Mhm.
So they don't know how to have control, regain control of their lives. They don't know how to
Mhm.
make it stop. And so they're going to have these additional issues compounding their confused identity. Then you tack in the alienating behaviors, and the alienating behaviors happen in high conflict divorce cases, but it's also happening in the foster care system. Sometimes it's because the kids are wanting to go home and see their biological family, and wherever they are, whoever they're with, there might be a tendency to speak ill of their biological
Mhm.
family.
Mhm.
Well, nobody wants to know that they came from something bad. Nobody
Mhm.
wants to know that they came from a quote unquote monster, whatever their biological family is framed as. And so it's really hard for them to hear these things. And we have to also bear in mind that their biological family is who they are.
Mhm.
And I've had kids that are in foster care ask me, well, when I grow up, I'm scared that I'm going to end up being just like my mom.
Mhm.
Well, hold on. You know, your mom had these miraculous parts of her, these blessings in her. She made some bad choices, but that doesn't make her a bad person.
Mhm.
And when you were created, when you were brought into this world, there were so many miraculous and wonderful things about you.
Mhm.
And you're still experiencing those things. So let's just focus on that part.
Mhm.
Um, so the alienating behaviors, talking bad about these parents or the family members, just exacerbates that confused identity even further.
Mhm.
So regardless of which population you're looking at, with the foster care or the high conflict divorce, the alienating behaviors, we know research proves that that is going to exacerbate confused identities.
So the combination of trauma, isolation, and a sense of helplessness over their over their own outcomes and what's going on in their life. And on top of that, behavioral health, alienating behaviors from the system or
Yes,
from the therapist.
yes,
Okay.
those are great words to summarize everything that I said. Yeah.
When I was in graduate school and studying child development, I had studied child development twice before at the undergrad level. And then when I was really young, when I was still in high school, I did a certification for early childhood education. And so we had to study child development. So, I got it from like this really rudimentary lens, and then at an undergraduate level, and then at a graduate level. In the last time I studied, it was the first time that I heard studies that show that actually conflict in a parent's relationship can be almost as hard on a child, or even harder in some cases, as direct abuse to the child. Like this, depending on the level and the degree of conflict, this can be so traumatic for a kid. So I can imagine, especially what high conflict relationship that then terminates in divorce could lead to massive identity confusion in these kids.
Yes, yes. They suffer from major identity confusion. They suffer from indecisiveness,
Mhm.
like levels of indecisiveness unlike anything else I've ever seen.
Wow.
They struggle with making the most simplistic decisions at times. So there is absolutely some long-term psychological harm. And usually what I tell the families that I work with, regardless of what arena they fall in, foster care, divorce, is that when we have kids that are exposed to this really high conflict for a long period of time, then they are overproducing cortisol, that stress relief
Yeah.
hormone. And as they're overproducing this cortisol, it's getting in and it's really changing their brain chemistry. And then they live in a state of fight, flight, or freeze,
Hmm.
and they're just stuck there. And so we've got to think about that long-term impact that they are going to experience from this extremely high conflict divorce. And kids don't know how to resolve the high conflict divorce. If two grown-ups are arguing, especially if they're their own parents, they can't just jump in and say stop.
Hmm.
And then if they were to call the police, then they're also scared that the police are going to come and arrest everybody.
Hmm.
And then what?
Yeah.
And so they cannot figure out how to solve that problem.
Hmm.
And it's very similar for foster care. And so foster care, the children that we work with, they are overrepresented in this transgender culture, because they 80% of them are suffering from major trauma,
Hmm.
PTSD, major
Hmm.
trauma. So of course they're going to be overly represented in the LGBT culture.
How do you, if you take the transgender piece aside, how do you work with families and kids who've been involved in this? And what does good therapy look like or good advice look like for a family with a child who's been exposed to that kind of high conflict and traumatic experience in their home?
So the first thing is that everybody needs to more or less take their adult issues and put them to the side. And we've got to
Mhm.
focus on the child first and foremost, which means everybody needs to be on the same page. And so earlier when I was talking about, as professionals or the academic world, which are also professionals, they all need to be in line with what the parental family values are for that particular child. And it's the same thing for parents as they're going through the divorce and their children are caught in the middle of their conflict. Everybody has to be on the same page. And so we start with something just as simple as having similar products at each home. So I like these
Mhm.
particular, as a female, I want these particular products at both of my homes so I don't have to pack that. That's
Mhm.
one tiny little step, but it moves mountains for
Mhm.
children because it also shows that mom and dad are willing to work together.
Mhm.
In the foster care arena, we need to be able to, especially in the orphanages, we have to be able to give the children an opportunity to experience an environment that's nice and
Mhm.
supportive
Mhm.
and loving. And oftentimes you'll walk into the orphanages and the staff are they're at wit's end. I mean, you've got
Mhm.
10, 15, 70 kids sometimes in these
Mhm.
placements.
Wow.
And the ratio here in Texas is 1 to 5, one staff to 5
Wow.
kids.
Yeah.
And these are highly specialized kids that they're
Challenging kids.
that's right. And they're teenagers, so it's not
Mhm.
like you're dealing with a 2-year-old.
Yeah.
And so you walk in, and the way that they're speaking to the children is very disheartening at
Yeah.
times, and not all the time. It's not all
Mhm.
the time, but
Mhm.
if I'm hearing it, then I know it's happening more than what it should.
Right, right.
And if these kids have just transitioned in, because they're the kids that we work with, they they move a lot. Their
Mhm.
their placements are shifted pretty frequently.
Oh, it's got to be terribly hard.
Yeah, yeah, yeah. I don't like to move. I certainly
Yeah.
hate that's so stressful. So imagine having to do it every 3, 6, 9 months,
And
and you're
having no
traveling in
power over it, no
right,
control over it. Gosh, yeah.
none, no
Yeah.
choices. And then they
Yeah.
give you a trash bag to pack your few
Yeah.
belongings that you have.
Yeah. Yeah. So providing that stability, tapping into if the family still has custody of the child and you can work with the family, then you're tapping into the core family values and drawing those out as strengths to ask people to get on the same page and work from.
Right,
And then
right.
if they're in the foster care system, trying to encourage the people who do work with the kids to see to treat them humanely and treat them with caring, which seems like a
Yep.
very bare minimum request.
Right, you would think. But I understand that there are so many complications in all of
Yeah.
this. And so trying to get everybody to agree to the same page is that one small step to get everybody started. And then to recognize, okay, so now that we're having some similarities in our homes or our placements, what are some of the next things? So continuity of care for the kids that are in the foster care system, making sure that they have the same providers for mental health, medical, to the best of our ability, or at least to transition them to the next. So that's that consistency part. And then to get everybody to agree on some similar rules. For foster care, when they're hopping from one home to the next, some homes allow cell phones and some homes don't. And the same thing with high conflict divorce and custody modifications. So yeah, treating them with love and kindness and being respectful, but also being mindful that they might look like adults, but they're still children.
Yeah.
So when they're confused, it's our job as the adults to help guide them and be centered in who they are. So in the high conflict divorce and custody modifications, we want to honor the family values. And when I've got, there are cases where moms and dads are splitting up and the kids have a confused identity. We really want to focus on living in the truth. Children are so impressionable and so easily influenced. And you know all about this, going through all the developmental courses that you, even starting in your teenage years, they're so easily influenced. And so, and let's add another component on here. We've got an overabundance of diagnoses falling on the spectrum. So autism, kids that are autistic are even more easily influenced. And so we want to be able to stay grounded in the truth and help them understand that. And if they turn 18 and they become an adult and they still have these beliefs that they are something other than what they were born, then that's a whole different arena. But as children, we want to protect the sanctity and the innocence of their childhood and help nurture them through that least invasive. I always tell my families least invasive first, and then we can move forward from there. But let's start least invasive. How do we do that?
And so when you're talking about keeping them grounded in the truth, are you directly challenging the transgender identity when it's popping up, or how are you seeing that as being a part of this process?
So it really kind of depends on who is in front of me. If I've got the child in front of me, and this is one of the things whenever I'm working with my interns, my counselor interns, we will breach this from a mental health issue, like a diagnosis of bipolar or schizophrenia, somebody that's in active psychosis. So if I've got somebody in the office and they are having active psychosis with hallucinations, and they believe that the TV is telling them to murder their family, are we going to affirm that? No. Are we going to argue with them? No. Why not? If we argue with them, then we're not going to be able to help them work through this and be able to test their reality. So we really want to understand what's going on in that moment. And so we start with mental health issues like that are much easier for us to process verbally. And then once we get through that portion, we transition over to discussing the transgender ideology. And if a minor walks in and has a confused identity, then the first thing is we want to understand what's the root problem. What's going on? How have you identified in the past? And then we really want to address certain things like what are the parental influences that we can bring in. So if social media, cell phones are, there's an overabundance of access to that in the child's life, then what are some parameters we can implement to pull the reins back a little bit?
Yeah.
But we want to be able to help the child test their own reality again, because the logic is what's lacking. And depending on where they are in the process of being affirmed by other people, so it really kind of depends on that too. If you're working with the family, if the kids have been affirmed for a long period of time or prolonged period of time, then it's a little harder to get the parents involved to pull the reins back a little bit. And to help the kids quickly be able to test their own reality and to understand perspective. So something that I do when we're talking about perspective, because again, perspective is a very difficult concept for children. So I have 2 sessions that I'll do with kids. One of them, we talk about perspective
Mhm.
specifically, and I have these different colored lenses. So one set of glasses has pink lenses, one set has blue lenses, one set's dark, and one set's clear.
Uh-huh.
And so I hold up a tissue, and a white tissue, and we talk about the color of it being white. And right now we're
Mhm.
looking at it, and none of us are in an emotional, experiencing any emotional turmoil. And so then I put on pink glasses or the blue glasses, and I'm like, what color is this to you? White. I'm like, well, I see it as pink. I'm very angry right now, or I'm very sad right now, and I see it as blue. Am I lying?
Mhm.
And they're like, well, no, but it's not blue, it's white. I'm like, I understand that it's supposed to be white, but I can only see it as blue right now. And so that's how we start to discuss this concept of perception. And
Mhm.
then the next session, we come back and I'll talk to them about testing our reality.
Mhm.
And we go to the fair, and let's say that you are at the fair for the rides. I go because I'm super pumped about the corn dogs and the chili cheese fries and all the junk food. I'm really pumped about the cotton candy, but they only have like Brussels sprouts and asparagus and broccoli. So I'm very disappointed in the fair. So I sit on the bench and I'm pouting. And if other people are encouraging this victimhood, then it's just going to get worse.
Mhm.
Then we leave and somebody walks up and says, hey, Leslie, how was the fair? You got to do all the rides. So you're excited. You're like, oh, it was awesome. And they say, Rebecca, how was the fair? And I'm going to say it was horrible.
Mhm.
Same fair,
Mhm.
totally different experiences. So, how do we test that reality? Who's telling the truth and who's telling a lie? And so, when I put it in those terms, those are very concrete examples for very abstract concepts. Kids
Mhm.
really seem to understand it and look at it a little differently. And that's kind of my intro to be able to help children test their reality and start to trust themselves again. That just
Mhm.
because I might perceive it this way or see it this way doesn't necessarily mean it's true for everyone.
Mhm. Oh, those are brilliant. I love those examples. I love the glasses and the tissues. It's so simple, but it really illustrates
Powerful.
something beautifully. Yeah.
Yeah, yeah. So those are just our lead-in sessions, and I think it works pretty well. We've been very successful with a lot of our kids. I would say it's more of a watchful waiting and
Mhm.
helping them grow in insight and reality testing
Without
rather than,
directly addressing the transgender issue, you're just helping them with all of their perceptions and thought processes, cognitive processes around their life in general,
right,
and
right. Yeah,
allowing them to untangle that piece themselves.
right. The cognitive dissonance that's been created due to the alienating behaviors, and then we rein it back in.
And do you find it really challenging when, I mean, I don't, and I guess I kind of wonder, do you find a challenge in the schools and in the other adult figures in the kids' lives and in their social cohort? I mean, when they are getting a lot of that affirmation and their school is going ahead and calling them by the wrong pronouns or the wrong name. And so you and the parents are the only ones in the room or in the child's life who are expressing some doubt or concern about where this is going. How are you finding that very often, and how do you work with that?
Um, I'm very blessed that in the area where I live, it's predominantly conservative, and so parental rights are very heavily respected for the most part. It does happen,
Mhm.
however,
Mhm.
unfortunately, but I don't think it's as abundant here as other areas across the nation. So this is part of what are some of the limits that the parents can set. Earlier, talking about the cell phone, if they have the cell phone, too much access to a cell phone and social media, then put some limitations on it or take it away altogether, but don't make it like a punishment. It's a
Mhm.
family thing, right?
Yeah.
So if the school is engaging in this, then what are our other options? Texas does not have school choice, so parents are very limited if their kids are attending public school. But we have had a huge influx of private schools popping up because parents are not wanting for their, even in my area where I live, where parents are not wanting that influence. And unfortunately, the influence is not just from the adults at the school, but it's the filthy books that are in the school
Mhm.
libraries or the
Mhm.
teachers' special libraries that don't have to go through the same process as the rest of the school.
Mhm.
And there's a lot of naivety uh, where other professionals within the academic world don't believe that they exist
Mhm.
or don't believe that they're in the
Those
school
books.
libraries.
Yeah,
Yeah.
and you used the word filthy. That's a really strong word. Would you say a little bit more about that? It sounds like you have a real reaction to this material.
So there's several books that I believe are very problematic. when we read books, they're so much more descriptive and it allows our imagination to just really run wild. So their books are very powerful. And I've used books for many years in the therapeutic process. Um, and so when we have books that seem very real and they claim to be fiction, but I've even had adults that they're like, oh, I thought this was a true story. No, that's a fiction book. But they're very convincing, and kids are going to naturally question themselves, especially if we've got a kiddo that's gone through major trauma that is in that foster care system or high conflict divorce. And so now I've got this book where I think I'm reading about myself. And as you know, whenever you're doing your abnormal psychology, they're like, be careful. Nurses and doctors, same thing. Like, don't diagnose yourself too much.
Yeah. Yeah.
Because we can identify in so many different things that we read. And so these books are very confusing in that regard. But then let's take it one step further. And some of them are so disgusting. It makes me turn bright red whenever I look at them because it's like very sexual in the content and the nature, with even with pictures for the older kids in the books on how to have gay sex, other sex than penile and vagina, but all these other types of sexual encounters and pictures, not just words, but pictures are in the books as well. And there's no reason for those to be in the schools. There's enough of that online. Like, why are we trying to put it in the schools? And so it's been able to get into our schools for various reasons based on sex education. And so our legislators have tried to change that law. I think it was House Bill 900 or something like that. But we're still at a standstill on it. So it's up to each independent school district to set the policies and procedures for that, and then to make sure that the books are out. Of course, my answer to the problem is, well, let's just write the healthy books and flood the system with the healthy books. Since we're fighting this fight, let's keep the fight going, but then let's flood the system with the good books, and maybe we can drown it out.
What would be a healthy book on sex for kids? Is there such a thing?
I think there are some healthy books, and I don't believe in book banning. I believe in putting books in appropriate sections. So for little kids, instead of having little kid books about transgenderism, why can't we use stuff like Mr. Rogers, where boys are boys and girls are girls? Why is that so bad? Because how is a child, why are we even discussing sexual orientation with small children?
Yeah.
So I do feel very strongly about the books that the children are being exposed to. And I think that there are a lot more books out there than what we realize exist. And they're very influential. And especially if I don't know that my child is reading something, how am I supposed to help them work through whatever they've just read? So this is like whenever I'm working with the families of divorce, if a child is in a car accident with one parent, and that parent's like, oh, don't tell your other parent, don't tell your other parent. Well, then they transition back to their other home later that evening. And a car accident can be very scary.
Yeah.
So you're putting that child in a space where they have to suffer all alone. They're not supposed to talk about that car accident. They can't work through it. So why would you want to let your kids be exposed to these books and not have the proper parental support, family support to work through what they've just read or seen in a book? Answer the questions in accordance with the family values.
I know this is kind of getting a little bit tangential maybe, but since you're talking about explicit materials in these books, I wonder what you see as the role of pornography in some of these situations and these kids and identity confusion.
I think that pornography has just run rampant in our culture, from cell phones to computers, anything online, anything that has access to online browsing the books. We have got to be so conscientious and vigilant and screening the things that are being shared with our children. I think that it's very toxic, and this goes right back to those long-term psychological effects. So I have two little boys, and whenever they see somebody kiss on TV, they're like, "Oh, God, oh, that's so gross," And so, what if they had a book where they were seeing more than just kissing? What's that long-term impact? And are they going to feel comfortable talking about it? Do they even have the words to talk about it? Because so many times when I'm working with my families,
Mhm.
no one knows how to talk about divorce, or nobody knows how to talk about being in the foster care system because we're not taught to talk about that.
Mhm.
Like I don't even have the vocabulary for it. And so when we start working on educating and understanding, giving words to the experiences,
Mhm.
it's so different because now I can verbalize what's going on in my family system, and then I can start to process the emotions.
Well, and something you're pointing to there with the kids being kind of recoiling from the romantic scenes in the movies, it's and kids are getting exposed to pornography now around age 8, 9, 10 on average. So if these kids are still recoiling from romantic attraction or romantic love, but they've already been exposed to really intense sexual scenes, including a lot of times violence or multiple sex partners in one scene, it's putting this up front before they're developmentally ready to even think about that. And so it's really getting things backwards. And I wonder what impact that has on people later, and including identity confusion. What does it have? What impact does that have on a young woman's flight from womanhood, or a man's disgust at his own sexuality? Like, this just makes, I can see how this is alienating people from themselves.
Right, right. Yeah, because they don't have the ability to process what they're like cognitively, they are not developed well enough to understand what's going on. So when I'm talking about development with families,
Hmm.
we talk about around the age of 5, they go through more development growth. And so, and I'm going to give you the example, but we say 5 and around 9, give or
Hmm.
take, and then again around 12 or 13, give or take. And so my
Yeah.
example is when we're talking about giving directions. So a 5-year-old, if we live a block apart, a 5-year-old might be able to take my hand and walk me around the block to get to your home.
Hmm.
A 9-year-old is going to be at the cognitive development where they can tell me how to go from this
Hmm.
house to this house. But a 12 or 13-year-old is going to be at the developmental stage where they can find shortcuts and describe the shortcuts.
Hmm.
And so that is, again, a very simplistic way of trying to process the development that we go through cognitively. And so when we're exposing our children, like movies have ratings of G, PG, PG-13, and R
Hmm.
and X for a very specific reason. Books should carry that rating too and be placed in the proper section so that
Hmm.
the little children are not exposed to these things that they can't unsee.
Hmm. Hmm. Absolutely. And could you tell me a little bit about the bills that you've been writing, the legislative work that you've been working on?
Of course, yeah. So these 3 bills that I've written, they are really unique. The first one is we're calling it the Sound of Hope Act, and
Mhm.
we named it after the movie Sound of Hope, and it's about a church getting involved in foster care. And it was 22 families adopted 77 kids, and they've adopted more since then. But um, I started writing this bill long before the movie came out. Well, when I finished it, that's a couple weeks later, that's when we heard about the movie, and it was just perfect. And so it's to cut the red tape and the bureaucracy to allow churches an opportunity to care for the kids in foster care. And churches are religious organizations are already doing that. Like they're the primary source of care for foster care. Unfortunately, the Biden administration also concurrently, as I'm writing this bill, so I didn't know when I started it, but the Biden administration passed a rule and it went into effect in July of 2024.
Mhm.
And it is called the Safe and Appropriate Foster Care Placement Requirements. So anyone that gets involved in foster care has to sign a contract that they will affirm the child's gender, use their preferred pronouns, use their preferred name, whatever that
Wow.
is, costing the families to basically violate their values and in order to serve these children that are the orphans. They need the help. So this bill is going to allow for churches to have a special unique path. We're not amending or changing anything, but it's a special and unique path to become a child placing agency, to use the church as the congress. The state can't come in and take the children away, but then
Hmm.
the congregation is then able to be trained by the church for foster and adoption, to be placements for foster and adoption.
Hmm.
But we're going to call them faith families. And so our number one goal is always to get the children home, if possible, to the biological family. And statistically, they say that 70% of the cases in foster care are there due to neglect and lack of resources. Well, we
Mhm.
can resolve that with a church congregation.
Mhm.
So even if the children are able to go home to their biological family, even after the case is closed, the faith family stays connected to the biological family. And so if something pops up, then the biological family can activate their resources and reach out to their faith family. And then the
Mhm.
faith family activates a bigger pool of resources by utilizing the congregation. So our huge goal is a reduction of recidivism.
Mhm. Mhm.
And then the church would then place the kids. They have the kids that are placed in their custody. They're the child placing agency. Then the church places them with a faith family. If they are a difficult to place child, the church can elect to also have a facility, an orphanage, and still match the child with a faith family. And then you start in small increments to get the child to the faith family more and more until they're able to move in with the faith family and ultimately be adopted.
Mhm.
So that's that bill. The other one is called the Vulnerable Youth Protection Act. And the goal of this is to ban the social transitioning. This is to require mental health professionals to not be able to use gender affirming care.
Okay.
So,
A
one thing
ban
these,
on gender affirming care for health professionals, not just behavioral health.
well, so we already, in Texas, we already have the medical side taken
Okay.
care of,
Okay.
but this would be specifically for the behavioral health side.
Okay. Wow. If you want to say a little bit more about that, I kind of interrupted
Sure.
you. Yeah.
No, you're fine.
Yeah.
So on that bill, we're using the alienating behaviors as the foundation for it because alienating behaviors are grooming. You are
Mhm.
grooming a child when you're affirming a child and going against the parents' values, the family values, violating their 14th Amendment of their rights as a parent. You are grooming that child into this transgender ideology, and their identity is changing. You're glorifying that. There's a lot of love bombing and trauma bonding and all of those things that are happening. And so, no more, when this bill passes, there will be no more gender affirming care. The
Wow.
other bill is going to kind of piggyback on that, and it's called reintegrative therapy. And this is a requirement for mental health professionals, all licensors in Texas, to be required to take one CEU to renew their license. And there will be a sunset on it of 10 years. But to require mental health professionals to take a CEU on alternatives for
Mm.
treatment when we've got somebody that's identifying in the trans community. Um,
Alternatives
but
to treatment.
alternatives to using gender affirming care.
Okay.
Yeah. So academically, because I haven't found anything other than gender affirming care, and I'm hopeful that in 10 years, academically, we'll be caught up. That's why we put a sunset on it. But until then, therapists need to know how to work with folks that are detransitioning,
Hmm.
desisting, and what is another alternative, like watchful waiting.
Hmm.
What's the
Hmm.
alternative in working with kids that come in? And this is specifically focused on children. Everything that I'm doing is
Children
oriented
under
for minors.
18 or okay.
Yes,
Okay.
yes, yeah.
This I'm really kind of appalled at this uh act that you're talking about from the Biden administration that requires foster families to affirm. And that seems outrageous, like that there's no screen, even if you take, let's say that there's some percentage of people who just know, let's just say for argument's sake that there's some small percentage of people who really know that this is going to be the right path for them to do sex trait modification and be happier with themselves throughout their life. Still, wouldn't you think that there'd be a bunch of false positives and a bunch of reasons for all the developmental and trauma history and all of these factors that you've just cited in this conversation, that there would be a lot of kids that would play with these identities but not go on to carry these into adulthood. We have the studies of desistance are that there's a high number of people that do desist, but this is an act coming from the very top saying that just a child saying so, the adults in their life must go along with that. And for a kid who is so out of control that they're in foster care, they have, like you talked about, this plastic bag, you got to carry your stuff from house to house. You're being shipped all over the place. You have so little control. You have so much helplessness in your life. The idea that you could use this as an anchor to control something, what a huge temptation. And this is
And
just being rubber stamped completely across the board.
mhm. Yep. And we know that children need boundaries. They need limits. They need to know what the rules are.
Mhm.
And they want rules. I can't tell you how many kids I've worked with over the years
Mhm.
that whenever I used to work in the field, and they would be out until 1, 2, 3 o'clock in the morning, and they would ask me, Rebecca, why doesn't my parent care about me? Like, why doesn't my parent call or give me a curfew or what have you? And even if you look at some of the parenting books from the late 90s and the early 2000s, there were studies that were done, one specifically about children at an elementary school, and they removed the fences around the playground. And so the children tended to congregate in the
Oh,
center
tighter and
because,
tighter.
yeah, because they didn't know what the limit was.
Wow.
So we need to give children limits. That's
Mhm.
our job. That's what we've been anointed to do, is to raise them up and guide them with limits. And we know that passive parenting is not going to be productive in raising up successful individuals. We know that authoritarian, especially in an American culture, is not going to be successful in raising up children that can be independent. It's that authoritative. We have to
Mhm.
have authoritative parenting where there's rules, there's guidance, there's influence. We'll hear what you have to say. My husband likes to call it a benevolent dictatorship.
That's what I
I'll hear
call
what
it in my family.
you...
I always tell my kids that this is not a democracy. This is a
Right.
benevolent dictatorship.
Right.
Yeah,
You get
I
to
love
have your
that.
democracy when you grow up and you're an
Yeah.
adult. Until
Mhm.
then, it's my job to make sure that the outside influences don't overwhelm you and take you on the wrong path.
Mhm.
Yep. So yeah, the rule that the Biden administration has put into play can cost states federal funding if they're not going to agree to it. So it's not just the foster families, it's the placements altogether, orphanages, placements with families. Everyone that has their hands in the pot to care for these children will be having their feet held to the fire to sign that contract if they want to continue.
Wow. That seems so wildly strange. I mean, if it's a mental health diagnosis, then that's a diagnosis from the president. And if it's a medical diagnosis, that's a diagnosis from the president. So either way, we're talking about the things that impact the child's medical decisions and mental health decisions, as well as just the very structure of their families. And these are all being done in one without any consideration for the individual in the circumstances, that people who are closer to that person might be able to better assess, is this a phase? Is this
Right.
something that we should, affirm? I mean, given even just saying giving some value to the idea of affirming. I don't necessarily, but just even if you do think that it matters in some cases or that it makes sense in some cases, you would have to think that it doesn't make sense in all cases. What in the world could be the motivation behind just unleashing this into our young population?
Right. A blanket statement of must affirm for all situations.
Yeah,
Even if you
yeah,
change your identity 15 times in 1 year, must affirm.
yeah. It makes no sense, and I don't understand what the agenda is behind that. It doesn't make sense to me.
Yeah. So least invasive. I always try
Mhm.
to tell my counselors, think least invasive.
Mhm.
How can I help somebody gain insight into who they are and grow awareness in how they are relating to not just themselves, but to other people? We have to be able to test our reality. We have to be able to understand perspective. We want to start least invasive. And I will never know who I am if I'm changing my identity 15 times. I will never know my home if I'm being moved 30 times in 2 years in
Mhm.
foster care.
Mhm.
Got to have stability.
Yeah, absolutely. And let's see. There's so much in what you're talking about. I think that this is really valuable. And the going back to one thing that we talked about at the very beginning, the alienating behaviors, and you
Mhm.
started to see this really happen more in 2015. One of the things that I really appreciate about your take on all of this and your values around this is how much you are respecting the parents, the family of origin, even in families that are dysfunctional enough that they've ended up in, like you say, a high conflict divorce, or the child is in foster care, you're hoping to be able to reunite. There's still a lot of respect being paid to the family of origin. And you're not, this is one of the things that I feel like it's almost just culturally normal now to act as if parents are a danger to their kids. and that there's something inherently suspect about families and parents. This has become so normalized that to hear somebody talking in this way with so much respect for family values, even in families with a high degree of dysfunction, is really refreshing. And when did you start to notice that you said around 2015, but what do you attribute that shift to?
Um,
Why did we change our perspective on families? Do you have a thought about that?
I think mental health professionals get into this field because they are people pleasers. They genuinely want to help and they want to save. They want to save everybody that they can.
Mhm.
And unfortunately, I also believe that a lot of mental health professionals enter this realm because they have something that was very hard and broken or traumatic in their own past, and they learned how to deal with it or navigate it. And they want to share that with other clients.
Mhm.
So good intentions sometimes don't pan out as they should. And when they hear these kids talking about their troubles and being suicidal and how mad they are at their parents, I tell families I can transcribe or I can translate. I'm an excellent translator of teen talk and adult talk. So I'm going to help translate the things that are going on. And I am very stern on, rigid on making sure that I've got the parents and the children involved whenever
Mhm.
I've got a parent-child conflict. But I think that mental health professionals, educators, because they want to save and they want to help, they don't realize that they're actually creating more harm than good.
Mhm.
And there is nobody that will love their children like a parent, a mom or a dad, not even an aunt or an uncle or a grandparent. Of course, they love their nieces, nephews, or grandchildren, but no one's going to be on that front line and fight like a mom and a dad. There is
Mhm.
no one that can match that.
Mhm.
And when we try to rob a child of experiencing that type of love, whatever it may not be the same time. I'm very doting and loving and affectionate. And there are plenty of people out there that are not that doting, loving, and affectionate. And there's nothing wrong with that. Just because it's Becca's way doesn't mean it's the right way. So why are we assuming this role of, oh, your parents are abusive? Let me take care of you. I can do a
Mhm.
better job. Why don't we give the parents the tools and help them learn how to translate what their kids are saying, so that they can have that connection with their children or have gain some insight to repair whatever the struggle is, and teach the kids conflict resolution. Because this, going right back to the alienating behaviors, when we affirm children, then we don't teach them conflict resolution. Well, Lord help us when we've got a bunch of teenagers that become adults that don't know how to resolve a conflict. We're
Mhm.
going to have some trouble.
Mhm. And even after working for almost 2 decades with CPS, and you still retain this much faith in families. What do you
Yes.
see that gives you that faith in families?
I honestly, it's the kids in CPS that continue to remind me how special families are, and this phenomenon of love that children have for their parents, and how they forgive and they will look past our flaws
Mhm.
as adults. Because my goodness, am I flawed? And I
Mhm.
know that. But my children are so willing and gracious to look past my flaws, and I love being able to see children love their parents, and then to be able to receive that love. Because when we're able to heal that hurt and get the kids back home, and that reunification, it gives me goosebumps just thinking about it. There is
Mhm.
just nothing that will compare to that. That is the best bonus check a
Mhm.
therapist can get, I think.
Mhm. And it just seems like right now we're in the midst of almost an iatrogenic cutoff epidemic where people are being encouraged to go no contact with their parents by their therapists. And so that alienating behavior, I mean, I think that you're really highlighting something very important and something really dangerous about the mental health field at the same time as you're offering an example of how it can be done in a way that actually helps to reunify and connect people to each other.
Yeah. Yeah. And so when I hear kids are so suicidal, you have to affirm they're so suicidal. they're not suicidal because you're not affirming. They're suicidal for many other reasons, usually because they don't know how to solve this conflict. So instead of just affirming and failing again to teach conflict resolution, let's stay grounded in our values. Let's encourage the family unit. Let's teach them how to have conflict resolution. And then they're going to figure out who they are. And then they're going to learn how to solve conflicts. And then those family relationships are going to be repaired. And then we're going to reduce the likelihood of adults growing up being super confused and even more suicidal. And I think that's something that we're going to see here in the next 10 years. We're going to have a whole cluster of now adults that were children going through this really crazy culture that are extremely suicidal. And I think our suicide rate is going to be off the charts.
What is the role of faith in your life and work?
I have a very devout faith. And I'd love to be able to say just because we don't agree doesn't mean that my love for you is going to waver or falter. And I start at home. Eleanor Roosevelt, no, sorry, Teresa, Mother Teresa said, if you want to change the world, go home and be with your family. So no matter what you do, we practice with our children that I'm going to love you. That's unconditional love, which is another thing when we start to affirm a child's reality or identity, then we're alienating them from who they are and from their family. They start to believe that love is conditional. And that unconditional love is something that's so powerful. And so I pray all the time for God to give me the wisdom, the patience, the ability to be able to love unconditionally. I might not want to be around you all the time because I don't agree with your behaviors, but I'm still going to love you because you're one of God's children. And the Bible is love, God is love. And so everything that I do is centered right on that. It's on love. Limits, but love.
Well, this has been such an enlightening conversation, and I really am. I hope that your bills go through. I hope that you're able to successfully see some change start to happen. And one more question, I guess, before we wrap up. With the interns that you see, how much indoctrination do you see them coming in with? And how much work are you having to do to like kind of cut through that? Or are you seeing people who come from pretty classically trained programs? I mean, what are you seeing in the new budding therapists that you work with?
That is a fantastic question. And I've had over 30 universities represented at my practice, and almost every single one of them have something about gender identity in their coursework. And every single one of the interns that comes out has this belief of must affirm, because that's all that's taught, which is why the Reintegrative Therapy Act is so important. When we start to process other options for addressing children that are confused, and saying, what are some resources that you can refer the family to? And I let them answer. And a lot of them are referring to the Trevor Project or, which just exacerbates the issue because there's no support in those resources that are going to respect and honor the family and the family values. So this is actually one of the things that I have a website that I created specifically for this. And it's for therapists, for parents to be able to vet out their mental health professional, but for therapists to be reminded that when you don't check the family values, and the example is this. My older son has some medical issues. And so we were in a lab getting some work done, and they had the news on and they were discussing drag queens. They called it drag shows. They said drag shows. So my son looks at me, he's like, what's a drag show? So meanwhile, I'm like, hey, can we turn this off? This really isn't appropriate for a 6-year-old. So we shut it off. And I explained, I like fast cars. And so we used to go to drag shows and drag race. And that's how I explained it. And let it go. Never said another word about it. And then I thought, I wonder what would happen if I were to propose this to my counselors. So I changed up the story a little bit, go to my counselors. I proposed this story. What if an 8-year-old comes in and asks, what's a drag show? And every single one of them explains that, oh, it's when adult men dress up like women and so on and so forth. So I let everybody answer. When they were done, I said, all right, now I'm going to file a grievance on every single one of you because you did not check my values as a mother, as a parent. And now my 7, 8, 9-year-old is walking out with this information that I don't agree with, that goes against my values.
Mhm.
You've imposed your own personal values, your own interpretation of what a drag show is, instead of checking mine. So that's an ethical violation.
Hmm.
So that's one of the things that I remind counselors, you have to know what the values are for the family before you engage in some of these conversations that could be very controversial. Because if
That
they
that
don't
seems like
agree
a
with it,
tricky one because the counselor might just think that they're offering a definition. And there might
right.
be lots of issues in the world that, like if a kid comes in and says, "What's abortion?" Do you want the counselor to tell them the truth about what that word means and just try to remain neutral with regard to value on that until they know the parents' position and values? Or what would that look like? I'm just curious how that
So,
would play out. Yeah.
so
Like a
I always
10-year-old who
say,
says, "What's abortion?"
yeah, I would say, in my head, I'm thinking least invasive.
Okay.
Well, tell me what you understand abortion to be. And
Hmm.
I want the kid to explain what they believe abortion to be. Have you had that conversation with your parents?
Hmm.
What have your parents told you abortion to be? And then we process through that. And if I'm still not sure how to gauge it, then I'm going to pause. I'm going to pull the parents in. And then we're going to all sit down and have that conversation.
Hmm.
Now, if we're talking about, very basic things and wanting a definition for, I can't think of anything right now, um, bullying. If
Okay.
we're wanting a definition for bullying, that's not,
Non-controversial issues.
yeah, that's different.
And if it's like
But
a 10-year-old who says, "What is sex?" I mean, like most
right.
10-year-olds probably know what that is, but maybe they don't. Maybe they don't. So is that one of those things where you would get the parent involved?
I, Ultimately, I want
Okay.
to explore what the child understands, truly what they're asking, what they've discussed with their family, and what they've
Okay.
understood from what their family has discussed. And then what are the values of the family? But really, I want to gauge it based on what the kid already understands and then
Okay.
bring the family in. But those are conversations that the parent should be a part of that session.
Okay. So you're saying that if there's any whiff of moral controversy around an issue, counselors ought to stop and regroup with the parents so that they're providing information from a position that's based in that family's values first and foremost.
If we have to address it from that perspective. I mean, sometimes I
Hmm.
can sit and least invasive and
Uh-huh.
process through this with the kid for the entire session.
Uh-huh.
That way we close the session, and then I can touch base with mom or dad or both and get an idea of family values. And then whenever we come back, if the kid still has questions, we can answer it. Or I may just arm the parents to be able to talk about it.
Hmm.
But if we as mental health professionals are supposed to be trained in helping to preserve that family unit and the preciousness, the worth, the priceless worth of that family unit,
Hmm.
then why wouldn't we want to include the parents? If
Right.
there's something broken about that relationship, then this is a great opportunity to bring them together and talk about something that can be really hard to talk about.
And what about, I know this is getting into the weeds, but I'm just really I'm curious about your perspective on this. What if you have one parent who is, say, affirming or pushing for it, or maybe it's both parents, maybe it's a single parent, and the parent is pushing for gender identity interventions, transition, things like that. And so you have a sense that the parent is doing something that, according to your own ethical training, seems like it might not be in the child's best interest.
So I'm very prayerful that our bills will pass. And so if I find out that somebody is doing that, then I can report it.
Hmm.
When there's controversy, if both parents are affirming, then I'm going to say I'm not the therapist for you.
Okay.
And
Okay.
my
So
my
you'll
schedule is
excuse
full.
yourself because you can't support that family's values. You don't feel like you
Yeah,
can ethically support their values.
yeah. And I think most of the families that are in that boat have moved or are going to move away from our state.
Oh,
And if we
really?
had
Yeah.
and if we had this across the board, if everybody was consistent
Hmm.
in this value system, then I think we would see a lot less of this happening.
Hmm. So bottom line, you do see a lot of your trainees, your interns, coming from programs where they've had one way of looking at gender presented to them. So there is some retraining or opening up of their perspective that you're having to do in that internship.
Right. And
Mhm.
most of them are like, man, I felt like there was something wrong with this, but I couldn't figure out what it was. And so
Yeah.
when we start reading and watching certain things, I think there's a lot of relief for them to
Mhm.
recognize that I don't have to affirm because I knew
Mhm.
something didn't feel right.
This has been my big concern about therapy. I have several concerns about how it's being done these days.
Mhm.
Um, not everywhere. Thank goodness there are still some really good counselors out there, but a lot of the way that new therapists are being trained really concerns me quite a bit. And the the way that therapists are being trained to be activists around
Mhm.
gender and race in particular is such a concern for me. Somebody recently used this phrase, are we, if the bathtub is overflowing, do you grab a mop first or you turn off the tap first? And I feel like the training is such a problem right now, the way that we're pouring out new therapists that are trained to think of themselves as interventionists and activists that are there to impart a particular ideology and re-educate people. And I'm really glad that there's internship programs like yours where you can help people to reintegrate with some classical notions of good behavioral development and family preservation. So
Getting back to the foundational pieces, components of our field, and we have gotten so far off kilter from that. So yeah, I feel the same way, and I'm very excited to know that other mental health professionals are joining forces and standing up for the right thing.
where can people find you or find your work if they are curious to learn more?
Well, they can go to, I have a few websites. One of them is the Counseling Center in Montgomery County. So that's counselingcentermc.com. I have a nonprofit called Love Heals Youth. So lovehillsyouth.com is that website. If you want to learn more about mental health in the state of Texas, you can go to grassrootstherapists.com. That's plural therapists. And there's a lot of information on there. And they can email me straight from there.
Awesome. Well, thank you so much, Rebecca. It's been an absolute delight to speak with you, and
Likewise.
I appreciate your time.
Likewise. Appreciate you having me.